Hello everyone, welcome again to our channel Yaami Fertility and IVF Center. Me and my wife Dr. Swati Singh, we have started this particular case stories in which we discuss the real life cases which we have seen in the past. Today's case is a young girl. She was around 28-year-old when she came to us, and the reason she came to us was that her periods were irregular. She was not getting her cycles every month and it was very irregular, and she was being advised to go for IVF procedure because her egg numbers were very low. When she came to us, we examined and we did the ultrasound scan, and we found that yes, ovaries, the egg numbers, the follicle numbers were less, but a typical thing was that the size of those follicles were very small. So normally when we do an ultrasound, these follicles are say between 3 to 8 millimeters in size on ultrasound, but her size were mainly 2 millimeter, 2.5, very small follicles. So such follicles are many times difficult to see also when you do an ultrasound scan. So then we advised blood testings for her, and we tested the hormone FSH and LH, which are the hormones which are secreted from the brain, from the pituitary gland. So what we were suspecting is that she might be having something known as hypogonadotropic hypogonadism. That means when the brain does not secrete the hormone to the required extent, and that's the reason that the follicle does not grow and the pregnancy does not happen. So these hormones were very low for her. Both were less than 1, FSH as well as LH. Then we discussed with her that, see, most likely your case is of hypogonadotropic hypogonadism, and then we counseled her that yes, IVF is an option. But then what we said is that, see, you have practically not tried even for a single month. And the reason being that because your follicles were not growing, the egg was not coming out, so you practically had zero chance of a pregnancy in whatever years you and your husband were together. So what we advised is that you take the injections. We'll give you injections because unfortunately when the hormone levels are so low, the tablets don't work because it needs the pituitary gland to function normally for those tablets to work and to act on pituitary for the follicular growth. The tablets like clomiphene and letrozole. So these tablets don't work in hypogonadotropic hypogonadism when the hormone levels are low. But the injections do work. Reason being, those injections directly act on the follicles. It does not act on the brain. It directly acts on the follicle. Then we counseled her that okay, we'll give you injections. We'll try for the growth of the follicle. Then you can think about it, and we said that you can even try naturally if the follicle grows. Though the cost of the injection would be there, but you can give it a try. So she said that doctor, cost is not a factor. So we'll try with the injections and we'll see. We gave her the injection. The issue is such patients, they take a little longer to respond. So she took around 18 to 20 days for her follicles to grow. And then the follicle got ovulated. We gave injection for the ovulation. She tried naturally and she became pregnant in the first cycle itself. So the first month her ovary released the egg, she became pregnant. So the reason for her fertility issues since last 3+ years was not that there was a major problem in either her uterus or the ovaries. The issue was that her hormones were not coming out from the brain at the level which it was supposed to. When we supplemented those hormones from outside, it did the trick. So here comes the importance that each and every patient should be treated differently. And so the approach of the clinician, the doctor, becomes very important. And that determines what kind of treatment would you be needing and how would be the success rate. So I hope you would have find this video helpful. In case you have any comments, any questions, please do put it in the comment box. If you want to consult me or Dr. Swati, we both work at Yaami IVF and Fertility Center at Indore, and we'll be very happy to help you out. Our contact details are given here. Thank you very much.